Dr. Lipi Roy, she's an internal medicine physician and the medical director for COVID isolation and quarantine sites for Housing Works in New York City. Dr. Roy, thank you for being here. The federal government bought up all the doses of vaccines early on, so they're in charge of those. But why is the government now in the business of monoclonal antibodies if they're privately made and can be privately sold?
Yeah, good to be with you, Chance. And this is such an important topic. Unfortunately, what I'm seeing yet again is politics really impairing and affecting this process of this global infectious disease outbreak. We really know how to prevent COVID-19. Unfortunately, what we're seeing is that politics, and specifically certain governors of certain states, are utilizing these monoclonal antibody treatments as their primary weapon to combat COVID-19. And my sense is that the Biden administration is trying to really counter that by saying, look, the primary way to really impact and contain this virus is through vaccination. It's not through monoclonal antibody treatment. Although that said, as a doctor, I will say that this treatment is necessary, and I am in support of all types of treatments for this virus, for which we really have no cure, but we do have effective prevention. I think that's why the Biden administration is stepping in now.
Well, as you were saying that, it kind of made me wonder as a physician, it can come across as punitive to certain states to say, well, you're not getting the vaccines we want or having the policies we want, so you're not going to get the monoclonal antibodies because we think you're misusing them. But like any patient, no matter who you are, you want the very best treatment and therapeutic you can get. You know, is it a double standard? Because the U.S., by that rule, should be just giving maybe vaccines to certain populations and sending it across the globe. We're not. If you have access to it and you can buy it, we buy it. Why are states any different?
You know, that's a really great question. And look, at the end of the day, my job is relatively simple, right? My job is, it doesn't matter who comes through the door of my clinic, of my hospital. We treat anybody. We don't ask about their political or religious affiliation first. Yes, we do ask about vaccination status, but that doesn't prevent us from going on and doing the treatment. But unfortunately, what we're seeing is that most of the hospitalizations because of COVID right now nationwide are among people who are unvaccinated. I still believe, that we need to focus on really providing proper education, listening to the people that are unvaccinated, and the reasons why. Most of the reasons are because of misinformation and because of politics, and that's what's unfortunate. As a doctor, I don't want to see anybody struggle and suffer unnecessary pain and suffering, and it causes not only an increase in healthcare costs but also clinician burnout. I mean, there's a lot of things that we have to worry about here. First and foremost, yes.
By the way, Dr. Roy, why is the supply so limited on this? I understand with mRNA it's really hard to do, but this, shouldn't it be quicker?
Yeah, great question. So actually, monoclonal antibodies, yes, they are generated in the labs. They are engineered, synthesized by scientists in a lab. But creating monoclonal antibodies is not simple. It actually takes a lot of work and a lot of research and effort. My understanding is that the Biden administration ordered 3 million doses from Regeneron, the company that makes it. I believe that Eli Lilly is also making monoclonal antibodies, but it takes a long time to make these therapeutics because they're proteins, and they're essentially imitating the antibodies in our own bodies. So it takes a long time to make them. Chance.
And really quickly, how closely are you watching the FDA's decision tomorrow on vaccine boosters? Because they're a house divided.
1000%. It's also a divided topic. I am watching very closely, and there really isn't a consensus here because on Wednesday, 3 studies published in support of the safety and efficacy of the vaccine. But at the same time, you heard Dr. Francis Collins, the director of the NIH, say that we really don't have enough data really to support boosters, but the experts are looking at a mountain of data. And keep in mind, most of the globe has not even received a first dose, and here in the United States, we're debating getting a 3rd dose. There's a lot of things to consider here, Chance.
Dr. Lipi Roy, thank you for helping us consider all those things because I wasn't aware of all those studies that just came out. We appreciate it. Thanks so much.
Anytime.